thank you very much, Dave. It's been a pleasure working with Dave on this project over the last few months as well, I must say that. So I'm just going to go over a few things really from a medical perspective. It's recognised that there are many barriers affecting a frank discussion of mental health, picking up exactly where Dave left off. There's a culture that exists. Pilots are highly independent, indeed very self-critical. Some people would say that they are their worst critics. They value control. They fear losing their medical certification. Successful approaches that improve rates of reporting, discussion and participation aim to provide a safe zone for such activities. And in so doing, they enhance aviation safety, optimise pilot mental health, minimise career jeopardy, and the stigma of seeking mental health assistance. The Aerospace Medical Association, this is their second quote. More attention should be given to less serious and more common mental health issues and conditions during the air medical assessment of pilots. There are many other mental health conditions such as grief, psychosocial stress, depression, anxiety, substance misuse abuse, far more common. They show patterns that facilitate early detection, and they have proven effective treatment strategies. So focusing on the catastrophic deflects from minor treatable psychological problems. That's a key message. We had Paul Reuter earlier today. He was a member of the task force that met on the 16th of July 2015. And recommendation 6, you can read it. I'm picking out the words non-punitive work environment without compromising just culture principles. Just culture means if you do something wrong, if it's a problem, you don't necessarily get blamed for it. However, you are responsible, and there are certain behaviours that you have to be responsible for. And there are limits to the no blame. And indeed, we'll come on to that with the concept of the regulatory framework for pilots. So the Bureau d'Enquête d'Analyse, they produced a report into the actual Germanwings accident. It was published in March 2016. I like the wording very much. This is a paragraph from the report. It echoes very much the words of the task force recommendation 6. I'm picking out some words. Discuss personal and mental health issues with the assurance that information will be kept in confidence in a just culture work environment. Supported, guided, help. So this aircraft's pushing back off stand. Peer support within British Airways is very much a new departure. We're at the pushback phase. We're selecting our peers. There's a long journey ahead. In simple terms, pilots can self-refer, or we receive, or rather the peers receive reports from concerned colleagues. It's the peer support advisor who receives reports. And what's very important is that the peer support advisor is supported by an independent health organisation to create the safe zone. The peer support advisor, supported by the independent healthcare organisation, can then signpost, guide and support people to the right form of help. That might be the Employee Assistance Programme, it might be the Wellbeing Portal, it might be British Airways Health Services for Specialist Referral, and these are all pathways that already exist within the organisation. So a little bit about the definitions. Peer support advisors must be British Airways line pilots. They're selected by the independent healthcare organisation overseeing the programme. They provide frontline support to those who contact the service, which is easily accessible, dealing with the initial contact, assessment of the issue or problem, signposting to the correct service, reflecting on the support episode. The peer support advisors must be personally suitable to undertake the work accountably and within their limits, undertake training and supervision. The independent healthcare organisation, and we heard previously about firewalls between both management and the unions. It is an independent healthcare organisation. They're responsible for training the peers, both initial and refresher, defining the role, confidentiality, boundary limits, listening skills, dual relationships. You could be supporting a pilot as a peer one day and the next day be flying with the same pilot in the flight deck. Psychological environment of the pilot and the regulatory framework. So the psychological environment of the pilot, who has better insight than a peer to actually understand what goes on in the flight deck, and the regulatory framework, which we've talked about, is always in place. Recognition when to refer to another service health professional, keeping records and clinical governance. They act as the data controller, and they run the program, day-to-day clinical support and oversight of the peers. Clinical governance is very important. Ultimately, anonymised summary reports and trends are presented to the monitoring group, which Dave mentioned. So governance, it's a word that's used often. What exactly do we mean? Program activity should encourage engagement. That really means a credible commitment to the provision of guidance, help and support. Confidentiality, we've heard a lot about today. The concept of a safe zone. It's an indispensable, essential ingredient to the success of any peer support program. It really is the sine qua non, without which not. However, there are limits to confidentiality within a just culture and a regulatory framework that exists. Accountability, clear communication. Perhaps the peer support advisors are the best people to provide communication. The program should be able to demonstrate continuous improvement of its quality. So it's more than a drugs and alcohol reporting scheme. It's more than post-incident counselling. Going back to that quotation at the very beginning of the presentation from the Aerospace Medical Association, it's the minor, treatable, detectable issues that perhaps we should be concerned about. I think Prof. Bohr and one other person listed them today. Employment issues and gripes, family relationship problems, failed simulator proficiency check command course, and this all goes back to pilots being their worst critics, ruminating on poor performance in the simulator, performance anxiety, physical symptoms, stress, alcohol and drugs fairly far down the list, and then reports from third parties. So the levels of support, starting from the top working down, it might be simply providing information. It might be support and listening, sharing experience. Talking therapy, and that would be with the support of the independent healthcare organisation. Signposting pilots to the correct, suitably qualified psychologist, or a more specialist referral, perhaps through British Airways Health Services. Final slide. The benefits. Pilot relationships with peers are more easily formed. Who has better understanding and insight? It's a place to share, help rather than penalise, and it may actually prevent mental health personal issues from becoming a greater liability to both the individual's career and the organisation's safety performance. Thank you.
Well, thank you to Dave and to Stephen. It's clear that BA are well down the track